Hi folks, Robert Haddo here with Full Spectrum Training Systems. I'd just like to talk to you about the difference between a structural abnormality and dysfunction. And see, a very common thing I run into is people having had imaging done, incidental imaging of one thing, and finding out, oh, there's another thing that's abnormal there, like a partial tear in a rotator cuff muscle, or an uneven length of mandibular ramus, the arm of your jawbone here, being longer on one side than the other, resulting in a slightly crooked lower jaw or mandible. And they're shocked because they don't have pain. They don't have any issue they're aware of. They're like, I don't get it. I can still climb or I can still throw, and I have a tear in my rotator cuff muscle. Why is that not hurt? Well, because it's not dysfunctional. It might be a functional abnormality. In other words, the way that you've developed over your life and the way that your central nervous system and peripheral nervous system has developed in turn with that is acclimatized to it and says, I'm fine with that. So that rotator cuff muscle, when you throw, you've learned to throw in such a way that that abnormality in the rotator cuff muscle is incorporated. It's not dysfunctional. It's part of who you are. When you chew, when you bite down, when you squeeze your teeth and you clench your jaw, your central nervous system says, I can coordinate that all properly in such a way that I'm comfortable with it, and it's not a risk, it's not injurious to me. So I'm not going to give you a pain or an apprehension or a weakness sensation. I'm going to give you full motor recruitment. I'm going to give you full range of motion. I'm going to give you full control. And I'm going to give you no negative side effect. Because that's just you. Just because you have some sort of a structural deviation from what's considered textbook normal doesn't mean it's dysfunctional. No one is perfect. We are all asymmetrical meat bags. So trying to worry about this needs to be perfect here, you're creating an arbitrary rule. If your central nervous system is cool with it, if you can perform your output needs safely, like running or throwing or jumping or chewing or turning your head to check your blind spot, whatever it might be, if you can do that safely and effectively, then your brain will be cool with it and you will not have pain. You might have an extra vertebrae. You might have an uneven pelvis. You might have an uneven leg length. And that's fine. So stop worrying about you have subluxations, you're out of alignment, oh, this bone is slightly longer than the other one, and start worrying about what you can do day to day. And if the pain is new, if something's just starting to hurt, and you've had this bony dysfunction, this bony abnormality for your entire life, it's probably not the cause. Because otherwise, you probably would have been in pain the whole time. It may be loosely correlated, but the chances are really good that it's not the issue. And if someone tells you that, then you should be seeing someone else. Because that's just bad science, that's bad critical thinking, and it's lazy. You do not want a lazy practitioner. Thank you very much.